Big news out today in the medical world that impacted the shares of several companies. The American Society for Clinical Oncology, also known as ASCO, as it's commonly known, out with some exciting developments in the search for new cancer treatments. Here to put it all under the microscope is Corey Davis. Corey is the Director of Specialty Pharmaceuticals at Jefferies Co. He's been covering this market for over 13 years. Also with us is Adam Johnson, who will be live at Jefferies Healthcare Conference that kicks it all off tomorrow. So a lot going on and a lot of movers today in terms of some of the healthcare names. Bristol-Meyers up 8%, Celgene up about 5%. What's some of the news behind all of that, Corey?
Well, ASCO is one of the biggest conferences for healthcare investors and biotech in particular. I think it's fair to say that there's more investment dollars within oncology than any other therapeutic area.
The study of cancer. Oncology is the study of cancer.
Right. So a lot of the innovation is coming from these smaller biotech companies. Just so happens that today Bristol-Myers, one of the bigger drug companies, on a drug that they've been working on probably for over a decade, had some great data in melanoma. And it's one of those areas where they've been working on it for so long, yet it was still worth the investment because there's still a lot of dollar signs out there for diseases like this where there's no drugs right now. That's why it was such a big deal. When you can get survival data for a cancer drug, that's a big deal, and that's what they hit.
And what kind of data do we get? How much better is this, the survival possibilities?
Well, it might not seem like much, but it was about 4 months. But
for which drug?
This is Bristol's drug, the vaccine for melanoma. Right, so if you've got an overall survival difference of about 4 months, it doesn't sound like a lot, but for these patients that are dying, can mean a lot. And it's just there are other metrics that you measure besides just survival, quality of life issues, and it looks like the drug will be
there are huge issues, in fact. Yeah.
Well, we got all similar data for Avastin, right? If you continue to use it, you can. For at least the ovarian cancer patients that were in this study, they got an additional 4 months of progression-free survival to 14 months total. Problem with that, and I'm not sure about the Bristol drug, but problem with that is that it's so darn expensive. It's about $60,000 to use it for a year. Has there been any talk about pricing? Because obviously it's been a huge focus in Washington.
Yeah, no, I think reimbursement for drugs is always going to be an issue. I've been doing this for 13 years, and it was an issue back then. It's an issue going forward. Everybody wants access to good health care, but nobody wants to pay for it. I don't know what the right answer is. Society will have to make those decisions as to what a life is worth, what a better life for a year is worth. But for now, we've got mostly a free market system, and one of the concerns is that when Washington gets involved in helping to set price on drugs, does that really undermine the whole system?
Is that one of the big themes for 2010, pricing issues and so on, in terms of healthcare reform?
I would say going out through 2012, when the new changes to the Medicare law kick in, nobody really knows how this is going to affect everything for drugs. So you got estimates all across the board, and one of the big themes is, does having 40 million more Americans taking drugs that aren't currently insured, does that volume increase outweigh the price cuts
lower margins
through the governments?
Yeah. Right, exactly.
What are some of the other themes that you're looking at?
So I cover the generic drugs as well, and the big move over the past 3 years for the generic companies has been to get into Europe. And Europe's a very different system for generic drugs. They save a ton of money in the U.S., but in Europe, they're still priced at only a little bit less than the branded drugs in a lot of cases, but it still requires a sales force, et cetera. But we're seeing the governments that control pricing over there really cut back on prices for branded generic drugs.
We got 20 seconds.
And the euro doesn't help, right?
Yeah, exactly. You got the Jefferies Healthcare Conference coming up. Adam, you're going to be there all day. You're going to be talking to CEOs.
It's the CEO parade. We literally have 9 CEOs over the course of the day. Corey's going to be there helping us make sense of the whole thing. It's going to be blockbuster only on Bloomberg.
Got a name for me?
There are a ton of names. Stay tuned. It's a surprise. There are a ton. 9.
That is a tease. All right, we're looking forward to that. All right, Corey Davis of Jefferies & Company, and of course our own Adam Johnson.
Thanks for having me.